Hi, good afternoon. My name is Carol Covey. I'm the nurse educator for the emergency department. Today we're going to review the new process that we've started this week called Plan B, Aleplase for acute myocardial infarction. At the end of this training, the emergency room nurses will be able to locate the STEMI kit in the Pyxis, identify the patient who will receive the Aleplase, assemble the necessary supplies for the Aleplase infusion, identify contraindications for Aleplase, provide continuous monitoring during and post infusion, and verbalize the signs of reperfusion. My target audience today is all nurses in the emergency room. Also, separate in-services are being carried on simultaneously for ICU, IMU, the charge nurses for each unit, and for the operations administrators. As I said, but my focus is the emergency room nurses. Aleplase is to be administered to STEMI patients that are unable to receive PCI within 60 minutes of arrival with the onset of symptoms less than 24 hours. Persons who present to the emergency room department with STEMI that symptoms have been ongoing for greater 24 hours and a PCI is not available, then these patients will make plans to transfer to the nearest facility that can perform PCI. The absolute contradictions for Aleplase for a STEMI are the exact same as the ones for Aleplase for a stroke. I won't list all of them, but they're found in the packet that each nurse has been given, which includes the algorithm for Plan B, also includes dosing cards and return demonstration forms for Aleplase for a STEMI. One of the primary absolute contraindications are any prior intracranial hemorrhage, intracranial or interspinal surgery within the last 2 months, active bleeding or bleeding diathesis, an ischemic stroke within 3 months unless they're having an acute stroke, and then these patients would still get the Aleplase as they would for stroke patients. Known or suspected aortic dissection or uncontrolled hypertension or significant closed head or facial trauma within the last 3 months. Relative contraindications are active internal bleeding, CPR that was performed for longer than 10 minutes, any surgery, major surgery within the last 3 weeks, pregnancy or early postpartum, a current use of anticoagulant therapy or coagulopathic conditions, recent GI bleed or active peptic ulcer disease. They're carefully going to look at most patients over 75 and patients who received medications to correct severe hypertension. Again, you have the list in your book, in your pamphlet, which goes over all of the contraindications. Prior to initiating the infusion of the Aleplase, you want to make sure the patient has 2 functioning IVs. They're receiving continuous cardiac monitor. They have a non-invasive blood pressure cuff. They also have pulse oximetry and receive an O2 to maintain the oxygen levels within 94%. Review the contraindications with both the patient and the family. And you want to notify the physician if there's any contraindications present. Next, you're going to review your order on the one source, and then you're going to obtain the STEMI kit from the Pyxis. You'll take this out under the patient's name, and then you'll use the barcode scanning to initiate your medications like you do all medications, verifying the dose and using 2 patient identifiers. As I said, Aleplase is a thrombolytic agent that we're quite familiar with, and we've given it lots of times for stroke patients. Now we're going to start giving it for STEMIs who can't receive PCI within 60 minutes of arrival and whose symptoms are less than 24 hours. The dose for the Aleplase for a STEMI is quite different from the Aleplase for a stroke. The initial loading dose for a STEMI, regardless of their weight, is going to always be 15 milligrams. Thereafter, will be given in 2 separate infusions. The first dose is 0.75 milligrams per kilogram if the patient weighs less than 67 or equal to 67 kilograms, and that infusion is given over 30 minutes, followed by a second infusion, which is 0.5 milligrams per kilogram up until 67 kilograms, and that dose is given over 1 hour. If the patient weighs over 67 kilograms, then they're going to receive the maximum dose. They'll get the 15 milligram bolus, followed by an infusion of 50 milligrams, which will infuse over 30 minutes, and then they'll get the second infusion, which is 35 milligrams, which will infuse over the next hour. Once the Aleplase is completed, then you're going to hang a 50 cc bag of normal saline and let that to continue to infuse until at the same rate and the same volume that the last infusion was given at, making sure that you've completely cleared the line of the Aleplase and the patient received the total dose. At this time, we'll take time and let each nurse put hands on the pump, and I'm going to ask each nurse to give a dose to program the pump for a patient who weighs less than 67 kilograms, and then program the dose for the patient who weighs more than 67 kilograms. For time purposes, I'm not going to show the demonstrations online. Once the infusion is complete, then you want to document in the chart what time the infusion was started, what time it was completed. You also want to monitor the patient for any signs of bleeding. You want to limit your venipunctures if necessary. To perform a venipuncture, you want to compress that area and apply a pressure dressing. I'd compress the area for like 2 to 3 minutes. Then if any bleeding noted, then continue for another 2 minutes. If no bleeding, then you apply the pressure dressing. You want to monitor your arm that the automatic blood pressure cuff is on, because a lot of times, even though it's hidden, they can develop a lot of petechiae and bruising underneath where the cuff is. You want to use non-shearing devices for repositioning the person in the bed. You want to monitor urine and stools for any signs of bleeding. And you want to complete your handoff of care to the nurse on the floor when you're transporting your patient, to include this patient received Aleplase in the emergency room. For a STEMI, the dose and the amount that you gave, the time it was started, and the time it would finish. You're going to monitor your vital signs every 15 minutes during the infusion, and then you're going to monitor your blood pressure every 30 minutes times 4 after the infusion, and then every hour for the next 8 hours. You want to notify the physician if you experience any problems. After about 60 to 90 minutes, it would be our goal that this patient would be in the ICU, but in the event they are not, then you want to assess the patient for reperfusion in 60 to 90 minutes. Signs of reperfusion include a 50% reduction in ST elevation, the absence of angina or equivalent signs and symptoms. They're no longer complaining of that chest pain. They're no longer saying they have a heaviness on their chest. And at this point, once you note that, you want to repeat the EKG and make sure that the attending physician or the cardiologist sees this. Does anyone have any questions? I would anticipate that some of the questions would be asked related to why is given in 2 infusions and why we have the safety feature on the pumps for infusing the first infusion in channel A and the second infusion in channel B. And I would let them know this is a safety feature. So the event if they weren't in the room, then and the pump alarm nurse would enter in the room would see this was channel A, and so that's the first infusion, and would stop before just putting in the repeat volume and letting the pump infuse until it's completed. Thank you for your time, and I hope this has been informative.